Welcome to this video where we're going to talk about what do you do if you're struggling with your mental health and how do you ask for help. Reaching out for help, while it may seem simple, it isn't easy. But why is it so hard to ask for help? Someone with a broken leg or asthma doesn't usually hesitate to call their doctor. But with mental health, this process is a little more complicated. The sad reality is getting help for your mental health issues can be as hard as admitting you need help. I can remember all too well how difficult it was telling somebody that I needed some help. And little did I know at that point, that was only half of the battle. So where do you go? What do you say? And more importantly, what should you expect to happen? Well, in this video, I'm going to talk about getting help and the key things you need to do and consider. So let's get into this. There are stats out there now that show the average waiting time to get help following a diagnosis of a mental health condition is 5 to 10 years. Just think about that, 5 to 10 years. In reality, it took me more like 15 years to get help, and I was lucky because I had the resources to go outside of the NHS for help. Now, for clarity, you shouldn't need these extra resources to get help with your mental health. In the UK, we're lucky. We have the NHS, this amazing institution that was set up in 1948 to provide us all with medical care. Now, bear with me here as I'm not bashing the NHS. I love the NHS. It does many wonderful things. I have many friends that work in the NHS. I do work for the NHS. I teach in the NHS. However, here comes the but. There's a problem, and it's been around now for a good while. There's this huge disparity between physical health and mental health. And until both of these are dealt with equally, the struggle for good quality help is going to continue. I've spoken to so many mental health professionals during my work and teaching, and all of them say the same thing to me. We're not good enough. We're not good enough in this country at supporting people and helping people with their mental health issues. But don't let this get you down, because knowledge is power, and with the right approach, you can get some help. Because the more you know about navigating your way through the system, the easier it is to get help. We all know what to do if we have severe chest pains or a bad fall or a bad cut. The process is fairly simple. We either call for an ambulance or we head straight to A&E. If we're unlucky and we've got a bad cut, we may have stitches, or if we broke our arm, we may get a plaster cast put on. This is all pretty much common knowledge. But this knowledge is very much absent when it comes to mental health. Why? Well, our mental health is not quantifiable. So where do you go if your partner's behaviour has changed and you're worried about them? Where do you go if your child's really anxious and going to school has become an issue? Where do you go if you're having a breakdown and you're struggling to get out of bed? And it's this uncertainty of not knowing what to do that means a lot of people do nothing and allow things to get worse. Why would you tell your GP what's going on inside your head if you don't understand it yourself? The thing is, no matter what you're struggling with, something can be done about it. So if you take nothing else away from this video today, please take this. You must ask for help. Don't leave it until it gets to crisis point. Anybody that asks for help is a champion, a total hero. And every time that somebody asks for help, it makes it harder for the powers that be that run this country to ignore the mental health crisis we find ourselves in. So let's talk about this. What do you do today if you're struggling? Well, you must contact your GP. This is vital. Your GP is going to be the gateway to getting additional support that you may need. And yeah, I get it. You may have to face the old baton reception, the line blocker, but don't let that put you off. Don't feel embarrassed about approaching your GP. Because I can promise you this, your worries and your problems and your mental health issues are not that unique, and your GP's heard far worse. I can remember it clearly back in the day when I went to my GP when I was struggling with all my panic attacks and anxiety. At this point in life, I was having multiple panic attacks and my mind was absolutely all over the place with disturbing thoughts. I told the GP things like, if I go out, I have to make sure I'm okay. I have to be able to get home early. I have to see if there's taxis nearby so I can get home. Sometimes I'm going to the venue and seeing if it's nice and open and if it's possible to sit near the door. And his reaction was rather deadpan. He just looked at me and said, "You're just a bit worked up." And there you go. There's a prescription for some antidepressants. I was placed on a waiting list for some therapy, to which to this day I'm still waiting for, because I didn't chase things up. I didn't have it in me. So if you've had a bad experience with your GP, you could try and speak to a different GP at your practice. Remember, it is perfectly acceptable to change surgery if you're unhappy with your GP. Now, if you're struggling to portray how you're feeling, you can take a friend or family member with you. But try and pick somebody that's strong enough to push the point across for you. It's okay for you not to feel your strongest, and it's okay for you to push help because you're entitled to it. Don't fall into the trap of sitting in front of your GP and saying things like, "I'm probably overreacting," or "it's probably nothing." It's so easy to downplay your situation. But from the off, your GP needs to understand that you're not in a good place. Now, your GP is busy, and in reality, he's probably only got 5 minutes or so with you. So when you go in there, full of nerves and very self-aware, it's easy to forget stuff. So make notes before you go. Break down into bite-sized chunks what's happening and how you're feeling, and don't worry how it sounds. Now, it's very easy to forget stuff, so you can always pick it up again with the GP on the phone afterwards if you need to. But before the end of your appointment, you must ask for a follow-up appointment, because you're about to embark on a partnership with your GP. And I promise you, if you're sent away for several months with just a prescription and no follow-up, that is a roadmap to failure. Now, you should expect to be referred to some other form of therapy within 6 to 8 weeks. And if you haven't been, you must chase it up. Because to get the care you deserve, sometimes you need to chase. And if you're not strong enough to do this, get somebody to help you. You're not harassing your GP by chasing stuff. You are holding them accountable for a service that they're duty-bound to deliver. So whatever happens, do not leave the doctors with just a prescription and nothing else. You must have a clear plan of action with your GP. Your GP should be taking a holistic approach to your recovery. They should be asking about your sleep, your diet, your exercise, your routine, because all of these are vital fundamentals. And if you need more info on these basics, watch some of my previous quick tip videos where I go into them in more details. So if you're struggling, contact your GP today and use the above process to help it run as smooth as possible. Now, in the coming weeks, I'm going to be doing more videos on what happens next. What happens when you do get therapy and what you should expect. So if you're struggling right now, please speak to somebody. And if you'd like any advice or you have any questions, please feel free to drop me a message or leave something in the comments below. And please give this video a like and a share, because somebody that you know may need to hear this today. So thanks very much for watching.